With this level of community immunity that we have now, we are in a position where we continue to make progress, removing some of the measures that are no longer necessary all the time. One of those is the BC vaccine card, which was very effective at supporting people to get vaccinated, but also during this highest risk period, being able to have these measures in place in those highest risk settings. So it is no longer required under order, so no longer a legal order, but we do know that many businesses are looking at their own clientele and their own people who go into theaters and movie theaters, and some will continue to require this. As well, businesses will transition from COVID safety plans to communicable disease plans. And these were the plans that got us through much of 2021, and we reinstated those COVID-specific safety plans early on in the Omicron wave when we still didn't understand exactly what the conditions were going to be with Omicron. So we're now going back to those safety plans, still being aware in every workplace of the risks and the measures that are important to be in place to reduce the risk to workers in all of those situations. Finally, we'll be removing the post-secondary residence vaccine requirement. We have seen that there are very high rates of immunization in young people, particularly young people who are living in residence in post-secondary institutions, and so this was not felt to be required anymore. Just to go back for a minute to the spring boosters, I wanted to reiterate how important it is for all of us to ensure that we are up to date with our vaccines, and that means now getting a booster dose. We are seeing a leveling off in transmission, but that doesn't mean our province is no longer vulnerable to new potential variants that are coming in the future. It's important for us to address the risk we have now, but also to think ahead. We're still in a transition phase, and we're still in this pandemic, and we still have a lot of uncertainty of what's coming next. People who don't have the protection that vaccine gives are at the highest risk, no matter what your age. And more data shows us that the booster dose at all ages decreases transmission, doesn't eliminate it completely, but even with Omicron, even with the BA.2, it reduces that risk of infection across the board and provides, as we've noted, very strong protection against hospitalization, ICU, and death. So now is the time to get your booster. If you've had Omicron in the last few months, you can wait up to 3 months, but we know that the booster dose does give you longer and stronger lasting protection, even if you've had Omicron recently. I think it's important to recognize as well that we are transitioning from these broad societal orders where we needed all of these measures all of the time, but it's not all or nothing. We need to learn to live with COVID-19 better to make sure that we continue our good habits that protect us, our family, and our community.